really fund something that they find morally objectionable. So that's one aspect that we want to kind of speak out on. The other is when you've heard some of the things coming out of Washington, D.C., you've heard about some of the bureaucrats that are basically going to be coming together to decide who gets what benefits in the public plan. And that's something that surfaced a little bit as well when you look at the history of some of the countries overseas, and especially with elderly care and what kind of benefits the elderly get in those countries. Really you see it's problematic in some of those instances. One case would be non-critical health care. A hip replacement is a good example, and Tara mentioned this a little bit more in depth from her experience in Europe. But our fear is that non-essential healthcare services could be cut out in the future when the massive spending that's going to have to go into creating such a program. They're going to have to cut benefits somewhere, and unfortunately, there's been talk of people that are younger and stand to be active participant of the working force, like myself, may get a little bit more than someone that's a little more elderly, and that's really, we find that morally reprehensible, that we would kind of put cost-benefit analysis on someone, whether they're younger or older. So thank you. That's something we're concerned about. An example is a hip replacement. That's something Tara will talk about later. If the government needs to save some dollars, and you have a lady perhaps 70, 80 years old that needs a hip replacement, as some of my family members have, it's vital to them because of their just the nature of their life and being able to get around, but it's not necessarily something that's life-saving. So that's a benefit that is a good example of something that might not be covered, and something that I think is going to be a problem for folks. Just thank you all for coming out once again. I'm going to pass it off to Tara here in a minute, but one last thing I want to mention is when you look at the cost of the plan, that's another issue that we think is going to be a problem for Hoosier families with all the spending that we've already seen come out of Washington. To add that kind of money to future generations, we really think is going to be a problem. It's going to either become inflationary a situation in the United States, or we're going to have to borrow more money from China like we've already done. There's going to be a point at which we can't spend any more money. We understand that the healthcare problem is a real problem and needs our attention, but there are things like tort reform, so doctors don't have to pay the massive insurance premiums to just stay in business. There's issues like being able to share insurance across state lines so that private companies can compete amongst one another. And you look at a government plan, that's not true competition, because as we've seen, the government can tax and spend and borrow and print money its way out of everything, it seems, but we know that's not true. You look at the economic problems and the state that's going to leave the family, and that's another problem we have. So thank you all for coming out once again, and please help me welcome Tara.
I'm Irish, and I'm sorry, but I probably brought the rain with me, so I do apologize. Okay, my name is Tara DeStock, and I've been asked to speak because I have unique experiences of living with government-run healthcare. I was born and raised in Ireland, and I also lived in the United Kingdom, and I'm going to give you an idea of what it's like living with government-run healthcare. Now, I don't have the advantage of any teleprompter, so please bear with me. The current administration is trying to convince us that if this healthcare reform is passed, our taxes will not go up. Who are they trying to fool? I'll use Ireland as an example. Outside of regular income taxes, you will pay a 25% VAT tax. When you buy a home, a 7% sales tax. When you want to put gas in your car, a 50% sales tax. They even have a 4% health tax. Now, the current administration doesn't seem to know how and when to stop spending. Millions, billions, trillions. Let's hope they stop soon. We only have 23 letters left in the alphabet. Now, the reason taxation in Europe is far higher is because of all the government-run programs, all the health care, and all the entitlements. There's a huge health care debate raging in Washington at the moment, but they don't seem to include our Washington has been listening to your voice?
No.
Are you tired of it?
Yes.
That's why we're here today, to have our voices heard and our message understood. Personally, for me, nationalized health care could be summed up in 2 words: waiting list. You hear many at the White House speaking about the wonderful health care in the United Kingdom and in Canada. And then you hear the horror stories of people living in these countries, and they've been denied critical care and life-saving drugs. What you don't hear about are the day-to-day experiences of living in government health care. When you get to see a doctor, you need a specialist, you have some tests that need to be carried out, and how it might work. Now, I have a friend who believes that if this healthcare reform is passed, she'll no longer have to pay a copay, that her visit will be free. Now, will it? I don't know. Nobody seems to know, and that's the problem. But let's talk about that free doctor's healthcare visit. Because when I lived in the United Kingdom, it was free to go to the doctor, but here's how it worked. You turned up at a doctor's office, you signed in, and you waited your turn. You couldn't make an appointment, you couldn't specify any doctor, and if you got out in about 3 hours, you were doing well. Kind of like going to the DMV or Social Security office, but they're also government-run too. Now, about 85% of the jobs in this country are created by small business. Raise your hands if you work for a small business, you own a small business, or have worked for a small business. So if you have to take 3 to 4 hours out of your day to see a doctor, you are losing income. So what is that healthcare visit going to do for you? How expensive is it really going to cost you? Does this sound like a good idea?
No.